All right. Lesson 3, building your support team. So your core medical team is going to include your OBGYN, your endocrinologist, and a maternal-fetal medicine specialist. So as is pretty standard, but potentially sooner for a type 1, you will be in touch with your OB around week 6 to 8. In subsequent pregnancies, so my first pregnancy, I was in at week 6 for my first ultrasound. Subsequently, I've had them closer to between, I'd say, 8 and 11 weeks. They definitely want to see you before 12 weeks, but especially for subsequent pregnancies, I think that this can be a little bit more personalized. But it is not uncommon that you would see your provider sooner rather than later. So knowing who you want as your provider, knowing, which hospital, things like that, you'll want to have an idea of that, because when you get a positive pregnancy test, when you miss your period, you want to be calling right away to get in with your provider. It'll depend on, where your blood sugars have been, what pregnancy it is for you, what your history with fertility has been, when they'll want to see you. But I would call right away, because that will be the first appointment that you have. So endocrinology or a diabetes specialist. So this could be, a nurse practitioner who has additional training in endocrinology, a CDE, maybe she's a dietitian, or whomever you're seeing has their CDE. Typically, you're going to see this person once per trimester, but you're going to have communication between visits. So it may be, timing wise, that you end up only seeing them twice, but communicating a little bit more depending on what your schedule has been with them previously. So maybe, you got pregnant right after you had your last, triannual visit, and they don't need to see you until later or something like that. But generally speaking, you can expect 2 to 3 visits with plenty of communication between. And what I mean by communication is uploading your pump, or uploading your records if you're not using a pump, and messaging between your provider or their nurse to have those records reviewed, and for them to give you feedback, or for you to check with the changes that you're making if you have concerns about how things are going. Ideally, you're able to sort of get an idea of how the flow of pregnancy will go. And I hope to give you those tools. But I want you to know that they expect you to be in touch, and it's not a burden to them for you to be in touch, if that makes sense. As much as I want to afford knowledge and, help you with predictive changes throughout your pregnancy by, via this course, my endocrinologists have always been really wonderful to work with during pregnancy. And I think that they anticipate a greater communication during your pregnancy. Okay. Maternal fetal medicine, or MFM. Your first meeting with MFM is going to be around 20 weeks. And then depending on your provider, depending on how your anatomy scan goes, maybe at 24, but usually 28, 32, 36, and weekly thereafter. It depends, I say, with the 24 week, because maybe they got all the pictures that they needed at your 20 week and they are fine with you waiting until 28 weeks. And not all of these are going to be growth scans. So that will come down to some of the decisions that you make about monitoring later. And we will come back to that when we're talking about planning for delivery. In overview, the anatomy scan is that big appointment, right? Where you expect to be there for quite a while, maybe 30 minutes, 45 minutes, depending on how long things take. That's about as long as they can do the scan for. But later, they're not only looking at growth, they're also looking at how baby is behaving in the womb. What is baby doing in terms of practice breathing? What are the muscle movements like? Things like that. And so the appointments that are beginning to happen around week 32, those are going to be really dependent upon if you're choosing to have these biophysical profiles that I just described, where they're looking at function, or if you're coming in for non-stress tests. And the timing of that is specific to which you elect to do based on what you and your provider decide is best and what you're most comfortable with. But you're going to see MFM quite frequently, and certainly more frequently than your average pregnancy. Okay, extended team members. Again, maybe you don't have a CDE in your life currently. a lot of insurance companies will cover meeting with a CDE during pregnancy to give you greater tips and, help you further your understanding of your pump, things like that. So that's an option. A nutritionist, and if you're someone who hasn't seen one in ages, that can be a really helpful thing to do. Or if you're managing particular aversions in pregnancy to, I don't know, to meat or to dairy, or you're having a hard time with what you're consuming, they can be a huge asset in helping you come up with ways to balance your meals and get nutrition despite nausea or something like that. And then the last one would be a mental health professional. Depending on what your current support network looks like, depending on how your mental health is doing during pregnancy, it can be really helpful to have a therapist or a counselor who can provide that support to you, or give you a little bit of backup. So coming back to MFM, there are 90% fewer complications seen in type 1 pregnancies when an MFM specialist is accessed as compared to having general OB care. Typically, there's going to be a lot of collaboration between your OB and the MFM specialist that you're seeing. So for instance, at my hospital, my OB is not a specialist. She is not an MFM OB. However, she works in close contact with MFM and manages my pregnancy, and then just talks with the MFM doctor who has reviewed the scans. She reviews them herself, and they go back and forth, and it's great. It's really simple, and I love that I get to choose the OB specifically that I want, as compared to maybe only having the choice of the fewer hyper specialists that are at MFM. They're wonderful, but I love my OB. So it'll depend on your hospital, which of course probably depends on if you are in a rural area or an urban area, if you're traveling from rural to urban for your care. But MFM specialists are generally quite easy to access in terms of being able to have them working in conjunction with an OB. So, what is the value of having your endocrinologist have a lot of experience with pregnancy? A huge reduction in hypoglycemia episodes. So a lot of endocrinologists are already really experienced, right? And we'll come back to some questions that you could ask to get an idea of how experienced they are. But having your OB, having your endocrinologist be ones who are experienced in dealing with type 1 specifically, since endocrinology is not only diabetes, gives them a lot of more fine-tuned information about how to work with type 1s throughout pregnancy. Integrated care, we're talking about communication amongst professionals, 35% reduction in emergency visits. So this is, talking about anything that could range from severe hypoglycemia to severe hypoglycemia, things like preeclampsia. And integrated care, where your providers can be in touch with each other, reduces those risks simply because they might catch something that the other person doesn't. And that is a great benefit to you. What are some questions that you can ask your providers? So you might ask your OB, how many type 1 pregnancies do you manage a year? Or you might ask your endocrinologist, what are your typical targets for pregnancy? And here I would say being on the same page is the important thing, right? Like, I'm giving you information. You can find the information online from the American Diabetes Association, but what kind of relationship do you have with your provider? And can you talk to your provider about what those targets are? And are you on the same page? How can I reach you if I'm having difficulty? You want to know like how they want to be reached and when you can expect them to be in contact with you. Their philosophy on birth timing and method for type 1 diabetes. I say this, again, we'll come back to other specifics on this later, but the standard for type 1 is to deliver via induction by at 39 weeks or about 39 weeks or before. There used to be a lot more push, I think, for an automatic cesarean or an automatic C-section. That's not been my experience. I have had my first pregnancy. My son was born via a C-section, but I've had subsequent VBACs, or a vaginal birth after cesarean. So I've had 2 VBACs and hope for a third. And my OB was the one to encourage that. So I think that some of the methodology or the standards on this philosophy have shifted in the last, I don't know, 5 to 10 years in particular. But you want to be on the same page with your provider and asking them from the get-go, when do you want, like, when would you expect me to deliver? And if they have that answer without knowing what your blood sugars have been or how your baby is measuring, it gives you a lot of information about whether or not your care will be individualized or not. And then severe hypoglycemia, asking, what are your expectations about hypoglycemia? How do you manage this? And what kind of support can I expect to have from you in managing this day to day? Some red flags. It's hard for me to imagine having a provider respond this way, but I know that there are providers who might. Just keep doing what you're doing. If they're not aware that the standards are changing, especially from an OB's perspective, they're probably not the provider for you. If they're unfamiliar with how to look at a CGM, then they're not the right endocrinologist for you. If they are resistant to having you check in more during pregnancy than outside of pregnancy, that's probably not a good thing, right? They should be understanding of the reality of managing a type 1 pregnancy, and that you may need to be in touch. Or if they're dismissive towards your concerns or your desire to learn, that's going to impact your relationship. And if your relationship is impacted and trust is affected, that's not going to feel good throughout your pregnancy. Okay, your personal support network. So partner preparation, education, family member roles, peer support. What does your peer support look like? We'll start at the bottom, just kind of the broadest level of support. Do you have friends that have type 1? Are you involved in a community support, like online for type 1? Do you know other people, or what are your friends who aren't type 1? How aware are they of the challenges that you face in your management and the extra burden that it is on you? The same is true for family and for your partner, but I think having friends and having some, to be clued into a support network where there's some understanding, even if it's someone who is just a good friend who doesn't have type 1, it can be so helpful to be able to just know that they're aware, right? Like, to have someone who isn't always asking questions, but who knows enough to ask questions. And then circling back to partner preparation, I remember in my first pregnancy, one of the red flags with the first provider that I had is that I would ask a question, and my husband, if he wasn't there, the provider wasn't really interested in answering. He was pretty old school, and he didn't really think that I should be asking questions. I should just do what he says. He would respond differently to my husband asking questions, and that was really frustrating. My husband ended up being the one encouraging me to switch to the OB that I have now, who I've had for the last 7 years. And it was one of the best decisions I ever could have made for my well-being, my peace, my confidence, and my ability to manage my blood sugars and to manage my pregnancies. So having your partner be aware of the difficulties that you might face, and primarily, I mean, the extra labor that you're putting in simply by managing your blood sugars, is really important. Something else, though, that's a part of that is how your partner is involved in the labor and delivery process. So for me, I wasn't required to switch from my insulin pump to an IV drip of insulin during delivery. Some hospitals do require that, but I wanted to know, and this was one of those like red flag appointments that I'd had. I asked, will I be required to switch, or can I keep my pump on? And he was like, oh, we don't need to worry about that. You're only 20 weeks. And I said, okay, but I'm already 20 weeks. And if my husband is going to be helping me manage my insulin pump during pregnancy, I want to give him time to understand how to turn off the alarm, how to administer a bolus, and to make sure that he's really good at doing those things, because it was relatively early on in our marriage and he wasn't doing it all the time. So that ended up being a red flag for the provider. But that's also kind of the preparation that you could do with your partner. And that could include understanding what your insulin levels ought to be. Like, what are your basal rates? What is your long acting insulin? If you're doing multiple daily injections, what are the rates of administration for your insulin? What are your blood sugar targets? How to treat a low, how to turn off alarms, or how to run your meter if you're using that, or if you have a CGM but you also use daily injections, or uh, how does your partner reference that CGM, things like that. Or when we get to labor and delivery and changing back to your postpartum settings or changing over to those, can your partner do that without you being involved? Are you comfortable with that? Knowing what your preferences are is equally as important. Okay, key takeaway here to wrap up this module. You are building a specialized team. You get to be in charge. You are the one who, for the most part, will get to choose your OB. That might be limited, but your opinion, your comfort level with your providers matters. So from your OB to your endocrinologist to MFM, you're going to be asking specific questions about their experiences and building a relationship with them that ensures that you have integrated care throughout your pregnancy.